My work has been looking at measuring a particular biomarker using flow cytometry on this patient cohort, on blood samples, and seeing if we can correlate that with outcomes and with suspected sepsis. And we found that we can anticipate sepsis and the need for antibiotics up to 3 days before the clinical signs are present in the intensive care unit. I'm Dr. Gabrielle Briggs. I'm a postdoctoral researcher and I work at the University of Newcastle, New South Wales. I started doing a Bachelor of Biomedical Science with the University of Newcastle. I then did a PhD in medical biochemistry with the University of Newcastle, and after that I pivoted slightly and changed the direction of my research. There was a position going at the John Hunter Hospital to set up a new University of Newcastle research laboratory in surgical sciences. So I changed the field that I was working in and basically built a lab from the ground up, a bespoke research lab for hospital-based laboratory research, and was working with the trauma service at the John Hunter Hospital and still am today. As a laboratory scientist, I work with the John Hunter Hospital Trauma Service, and what I look at is the immune response and some of the mechanisms behind the complications that occur in that patient cohort, like multiple organ failure and sepsis. In that role, it also leans into other areas such as orthopedic surgery and intensive care. One of my other interests is sepsis and how we can rapidly diagnose sepsis. At the moment, we're doing some clinical observational work in the intensive care unit, and we're looking at whether we can more rapidly diagnose sepsis. I've spent the last 5 to 6 years looking at daily samples from the intensive care unit and looking at whether we can find biomarkers for early sepsis detection. It's very important because a lot of patients acquire infections and can acquire sepsis in the intensive care unit, and we may be able to screen patients daily to pick up early signs of infection. So my work has been looking at measuring a particular biomarker using flow cytometry on this patient cohort, on blood samples, and seeing if we can correlate that with outcomes and with suspected sepsis. And we found that we can anticipate sepsis and the need for antibiotics up to 3 days before the clinical signs are present in the intensive care unit. I work with the University of Newcastle. However, we engage strongly with the Hunter New England Local Health Service and also Hunter Medical Research Institute. These are local institutions that are absolutely essential to my work and provide me access to the really important patient samples for my research. The research is funded from a number of different sources. We've received seed funding from the Australian Orthopaedic Association, from the AO Trauma Association, from Hunter Medical Research Institute, and from internal funds from both the university and the John Hunter Hospital. As a researcher, I think it's very important to see what the future impact of your work might be, rather than just thinking about the short-term goals of publication. So something that's always driven me is thinking about how my research is going to have an impact in the real world, and ideally I'd like for that to be in my lifetime so that I can have that sense of leaving a lasting impact and leaving a legacy. It's very important to me doing this work because sepsis is so much more common than people think, and it's a huge burden on the healthcare system. And often when sepsis patients are suspected and diagnosed and treated with sepsis, it's already quite late in the course of the disease. And so something that drives me is the idea that we could be catching this a lot earlier, and that this would be guiding earlier antibiotics and earlier treatment of sepsis, prevention of the more severe complications altogether. Well, I'm a keen runner, and I've just completed the City to Surf, and I've also done a few half marathons and really enjoy just getting a few good runs in during the week. I also enjoy a bit of gardening. I've recently got a property that has a great vegetable garden, and I'm keen to get stuck into that and try to grow some of my own food.